we still put too many obstacles in the way of doctors and nurses wanting to do the right thing. Bureaucracy, as we saw in the video, blurred accountability, and a blame culture are still too common. So here are 4 elephant traps that we need to avoid, followed by some areas that we need to go further and faster to harness the opportunities offered by empowering patients. So firstly, the 4 elephant traps. And number 1 is the bureaucracy trap. Surely, people say, technology will help to reduce bureaucracy by eliminating repetitive form filling. Well, not as we saw earlier in parts of the US. Whilst thanks to President Obama's Health Information Technology for Economic and Clinical Health Act, the US has gone further and faster than most countries in digitizing hospital records. This change has met huge resistance from doctors because of the extra burden that can reduce contact time with patients. Put simply, for many doctors, it feels like screen contact has replaced eye contact. One recent US study videoed 100 patient visits and found doctors were spending a third of their time looking at their screens. Another found that emergency room doctors spend 40% of their time filling out online forms and just 28% with patients. An emergency department in Arizona tried to attract applicants by stating on the advertisement that they had no electronic medical records. This was a selling point for the hospital. And in the UK, there are some people who think that the new IT system at Addenbrooke's helped tip that trust into special measures. The lesson here must be to ensure that new IT systems improve rather than reduce clinician productivity, so that it helps rather than hinders them in their jobs. Professor Robert Wachter of the University of California, San Francisco, says that this means understanding that the digitization of healthcare is about adaptive change rather than just technical change, a change in behavior rather than just new process. And I'll discuss later the need to get this right in general practice as well as in hospitals. So the first elephant trap is the bureaucracy trap. The second elephant trap is the accountability trap. One of the best reasons for investing in digital records is to allow communication between multidisciplinary teams in different organizations for patients with complex needs. By making cross-team and cross-agency working easier, though, there is also a risk that accountability to the patient is blurred. Let me read you this from a recent report about a tragedy in our NHS. Assurance, it said, had become circular. The CQC had taken reassurance from the fact that the PHSO was not investigating. The PHSO was taking assurance that the CQC would investigate. The SHA was continuing to give assurances based in part on the CQC position. Monitor asked for assurance and received the perceived wisdom. Now let me read you a line from a completely different report about a different tragedy. There was a systemic culture where organizations took inappropriate comfort from assurances given by other organizations. As a result, organizations often failed to carry out sufficient scrutiny of information, instead treating those assurances as fulfilling their own independent organizations. Those were about Morecambe Bay and Mid-Staffs, respectively, perhaps our 2 greatest scandals in recent history, with more in common than we've cared to admit. But one of the biggest lessons that I've learned in my time as Health Secretary is that if the buck stops with 6 people, it stops with no one. Technology should allow easy communication with the person responsible for your care. But what if no such person exists? We must never let shared records become an excuse for diluted accountability or the lack of a personal touch. which is why the work done by the Academy of Medical Royal Colleges about clinical accountability outside hospitals is so important. And I'm absolutely delighted that that guidance has been published today, and it really is excellent guidance, and I strongly encourage everyone to spend the time to read it. So accountability is the second elephant trap. The third elephant trap is what I call the cost trap. Computer systems are expensive, and they can also be a total waste of money. Look at the Connecting for Health catastrophe. £9 billion over 10 years came to virtually nothing in our biggest ever IT disaster. Whilst all such investments have the right intentions, many in practice divert resources away from frontline care. And often the investment was targeted at improving organisational convenience rather than patient experience. And the lesson here is surely that incremental improvements closely tied to clinician productivity and patient experience are as valuable as big bang changes, which carry much greater risk. So that's the third elephant trap, the cost trap. And then the final elephant trap is the data security trap. We need to be honest. None of this, none at all, will be possible if the public don't trust us to look after their personal data securely. Remember Vinod Khosela's 300,000 biomarkers in a single drop of blood. Who will send their sample to a laboratory if they're worried about the security of highly personal information? The plain truth is the NHS has not yet won the public's trust that it is competent in protecting basic personal information. Hospitals, GP surgeries, and social care organisations do not yet all have proper data security protocols in place. So the new data guidelines being developed by Dame Fiona Caldecott, our National Data Guardian, as well as the CQC's review, both of which will be complete by the end of January, will be absolutely vital. So let's be ambitious when it comes to technology, but let's be humble as well. We haven't always got this right, especially when it has interfered rather than enhanced the relationship between doctor and patient. So I am delighted to announce today that Professor Robert Wachter, not only of UCSF, but also author of The Digital Doctor and a world expert on the promise and pitfalls of new IT systems, will conduct a review for the NHS on the critical lessons that we need to get right as we move to a digital future. He will guide and inspire us, as Professor Don Berwick did on safety, and we look forward to receiving his report next summer. So those are 4 elephant traps to avoid.